G'day everyone, this is Stu from Plan Manage Assist, and this is NDIS TLDR, too long, didn't read. And so today I have Richard from Potentiate Rehab with me. How you going, mate?
Good, how are you?
Mate, I'm doing really well. And so I actually am so excited to hear about this one because it is a topic that I'm an expert in, and that I am so keen because I want you to talk to me as if I've got no idea.
Yep.
Absolutely assume that I have no idea what you're talking about. Just not for me, because I know, not for me. I'm well, but it's because I want everyone else out there to learn about this. And this is the idea of respiratory physiotherapy.
That's right.
So for those that aren't familiar, just because we have no idea, tell us more about it.
Yeah. So respiratory physio is a particular branch of physiotherapy that we do here in Australia. A little bit different to some other countries like America where they have dedicated respiratory therapists. But here in Australia, respiratory is actually a particular almost like a requirement in terms of the skills that you need to learn as a physio as you go through your university degrees. Okay. What that involves is the main things that we look at is people's lungs, by name, respiratory. Yeah. So what we really look at is how people are going in terms of their breathing, the effectiveness with that, as well as the clearing of phlegm or secretions, and as people go throughout their day-to-day. So for the regular person like yourself or myself, usually there's no issues. We breathe fine, happens in the background, we don't really think much about it. In terms of a secretions or phlegm's point of view, our lungs naturally produce it as we breathe, things in. Sometimes there's little, dust particles or whatnot, and our lungs clear them out, pops it in the phlegm so that we can clear it. So it's kind of like the body's vacuum cleaner, or Dyson if you want to liken it to that.
No, it's clever.
In terms of lungs. So what happens sometimes is that when people have conditions such as COPD or asthma, or say they've got cerebral palsy, they've had a stroke, which impacts their ability for the body to use those, or the lung to do its system effectively, that's where respiratory physio comes in to assist them with breathing more effectively through different breathing techniques or exercises, or helping the body clear out the phlegm that's kind of pooling there and not really being cleared out. So that's the role itself.
Okay, so it's about really sort of building that strength around the ability for the lungs to do the job that they would naturally do on their own. Yep. So how would then a respiratory physiotherapist come in and do that? What do those exercises sort of look like? Is there a certain regimen? Is it something special that's being done to help encourage that?
I think it's really about a very thorough assessment, because when you assess a particular client, you just need to see what their needs are, as with any other regular area of physio, whether that's neurological rehab or your musculoskeletal stuff. You just need to see what the issue is. You don't want to provide a blanket treatment. So usually what that entails is we go there, get a bit of a detailed history in terms of what their concerns are. Are they finding difficulties with breathing? Do they feel like they're wheezing? In terms of the phlegm, do they feel like there's phlegm that's really sitting there? They've got a very chesty cough, but they can't clear it out, or any other issues that they're complaining with. So in terms of that, once we've got a good idea in terms of what they're experiencing, then we'll go and do the assessments themselves. So usually what I'll do is I bring my stethoscope to each appointment. I have a listen to the lungs, just to have a listen to what is going on. So things I might be listening out for are, is there wheezing that I can hear as I'm listening to the lungs? Are there particular areas of the lungs where there's not much airflow going in and out of?
Yep.
And then are there signs or sounds, what we call coarse crackles or crepitations? That's when there's phlegm that's in the lungs, and you can kind of hear like a little crack as the, it's kind of like bubble wrap. It goes pop, 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 pop.
Okay.
Essentially what that is the air blowing over the phlegm as you go in and out.
Right.
So normally in a regular person, because the lung clears the phlegm quite effectively over the course of the day or as it gets produced, you won't really, or you shouldn't expect to hear that. But when you have a listen and you start to hear those things, that's when you start to think, okay, there might be a little bit of wheezing, so I know there's a bit of airflow limitation, but I'm hearing some crackles as well. That leads me to think that there's some issues with clearing the phlegm. Let me try out some of the techniques in terms of clearing the phlegm to assist them with that issue. Because I don't want to, do those techniques for someone if they, don't have a need for it, if that makes sense.
Yeah, okay. So then what some of those techniques might actually look like? Because I know that we've got a participant, they've got the need for it because they're having that issue. What might some of those exercises and activities look like?
Yeah. So in terms of breathing, so what we generally do is deep breathing. So that's quite basic in the sense that you're taking a deep breath into your maximum capacity, holding your breath, and then breathing out. But then sometimes you just have to consider the other medical conditions as well. So, for example, if there's someone who has a very high carbon dioxide level in their blood because of conditions, for example, COPD, we might need to omit certain parts. For example, instead of holding the breath, just do the breath in, just do the breath out. So just tearing and just make sure that we're not exacerbating things, because obviously if we're holding our breaths, then we're almost keeping in that carbon dioxide and not then we'll get rid of it. Things, for example, for getting rid of the phlegm, that could be things such as percussions or vibrations. So what that is what you'll sometimes see is people hitting on the chest. Now, if people are quite good in terms of clearing the phlegm on their own, we might use things such as special devices. They're called acapella devices, or even PEP devices. Some of the brand names that people might be familiar with are Flutter, the acapella, and then there's one, I've got the name, can't remember off the top of my head, but there's a few of these devices. And it's just finding out which one would be most appropriate to prescribe them, just to assist with clearing that phlegm. So you've got whether or not we should be using devices, you've got manual techniques if you need, and then really it's about upskilling the family, because as mentioned, the lungs naturally produce phlegm over the course of the day. I think it's quite impractical for a physio to be there 24/7 or on call all the time. So it's really about upskilling family, upskilling support workers, upskilling house managers, so that everyone on board involved in this person's care knows what they need to do in order to help them if there's a particular time where they feel quite chesty and they can't get the phlegm off.
Yeah, absolutely. Okay, so it's great that we've got these different ideas for respiratory physiotherapy for those that are sitting up or laying in a bed, but what about people that are on a ventilator?
Yeah, so we definitely do have, we provide service to clients who, perhaps because of their neurodegenerative condition, they've gotten a little bit weaker, they're not breathing as well as they are on their own. So that's when we, they might have talked with their doctors and they've decided to utilize a ventilator just to provide more comfort. For these clients, generally they do tend to be a little bit more prone to things such as lung infection, pneumonias. So what we do is same again as before, assessments, but it's going to be a little bit different where perhaps because of the weakness in the breathing muscles, they're not coughing up phlegm quite effectively. So that's where things such as suctioning comes into play, where we use a suction catheter to actually go down into the lungs to manually clear out that phlegm. So similar to the other respiratory physio, because we can't be there 24/7, again, it's a lot of upskilling for family, for support workers, as well as any AT report writing to actually advocate for that equipment, because there's no point having some of these things if no one knows how to use it.
Absolutely.
So that's the main thing for us. It's teaching people how to use it, make sure that the care, team is well informed so that this, the client themselves are getting the best care that they, is what they need.